We arrive on the scene. We're the first ones to get there, and we walk into the front door, and I just hear screaming. And she's like, I'm upstairs. So I go upstairs, and the first sight that I see is a mother doing CPR on her daughter, who's roughly 16, 17 years old. At this point, I'm like 22, 23, and I have a little sister who's also around that age. So we get up to her. I pick her up, put her on the ground. Mom leaves the room. She's hysterical. We start the process. We start CPR. I put the pads on. Rhythm was asystole. We get the drill in. I'm trying to get an airway in, but I realized that the jaw was rigored at this point. I just couldn't stop care.
Welcome to In Service, the EMS podcast, where frontline experience meets leadership insight. Hosted by Jason Falvey, a seasoned paramedic and EMS leader with over 30 years in the field. This show brings you conversations with people shaping emergency medical services today. From street-level medics to innovators on the bleeding edge of EMS, we dive into real stories, leadership strategies, and what it takes to build high-performing teams in high-stakes environments. Let's get in service.
We copy you down, Eagle.
Tonight, I'm joined by 3 paramedics who took very different paths into EMS. Each one brings sharp, honest, and unmistakably authentic voice to this conversation. Andrea Marquez is a 10-year medic known for her steady presence, strong clinical instincts, and the kind of compassion that stays with patients long after the call is done. She's faced tough moments, including calls that have left lasting marks. And she talks openly about how those experiences shaped her both as a provider and a mother. Tyler George came into EMS from the creative world, jumped into the fast-track pipeline, and proved himself quickly on high-acuity calls. He's thoughtful, humble, and unflinchingly honest about what it's like learning to lead scenes, trusting your instincts, and growing through the hard ones. And Mitchell Lamb, a Georgia native with an adrenaline-junkie streak, is a confident, capable medic who stepped straight into critical calls through the accelerated pipeline. He brings humor, intensity, and hard-earned perspective, shaped by everything from complex arrests to the infamous Butterman call. 3 medics, 3 very different journeys, all of them here to talk about what it's really like to go from zero to hero. Hey, welcome. Good morning, guys.
Thanks for having us.
Good morning.
Yeah, thanks for coming in on this Friday morning.
Thanks for having us.
Thank you, Jay.
So this morning we're going to be talking about the paramedic pipeline from zero to hero, the accelerated program that gets you from citizen to paramedic in the quickest amount of time. So let's roll into it, and we'll start with Andrea. Where'd you grow up? Where are you from?
So I grew up in Panama City, Florida, moved up to Georgia in 2019. I've been working as a paramedic for the last 10 years.
Awesome. Tyler?
I grew up in Arizona in a little town called Buckeye, and I moved up here shortly after Andrew did back in 2020.
Awesome.
Right before COVID.
Hey, Mitchell.
Hey, Jay. So I grew up in Georgia. I was in a little town about 40 minutes north of Atlanta. Saw it go from nothing to a big old city now. Always been a bit of an adrenaline junkie. Always enjoyed rock climbing, caving, cliff jumping, skydiving, all that kind of fun stuff. I've always been attracted to a little bit of adrenaline and danger.
You left out spoon collecting.
Spoon collecting, yes.
Yeah.
Of course, stamps too.
Andrea, what got you into EMS in the first place?
When I was 18, I always wanted to be a paramedic. Used to see ambulances drive by with their lights and sirens on. I got really excited and always thought, man, I bet it's fun to do that job. At that point in my life, I was too immature to move forward in a career like that. But years later, I made a decision to go after my dreams. When I was in my early 30s, I decided to make that transition. And it's been a rewarding career ever since.
Excellent. Tyler?
In all honesty, Jay, I had no real ambitions in going into EMS in the beginning. Originally, I got my degree in arts and photography, and I worked as a videographer for a little bit in Arizona. But I quickly fell out of love with that job and started wanting to pursue other career fields. One of them was nursing. I went back to school to try and get my bachelor's in nursing. While going through that pathway, I ran into an old high school friend. While talking over drinks, he got to talking about how he had just taken the EMT program at our local community college. The more he talked about the program, the more he talked about being in the field, it really resonated with me, and it really got me interested into what EMS is. Mine's going to be very similar to Mitchell's on it, just from the standpoint that we both started Gwinnett Tech. We both went through the EMT program, and I got very annoyed at how little the EMT scope was. That's why I went to medic then, but I didn't originally plan on it. I figured if I'm going to go into the medical field anyway, I may as well try EMS, and I fell in love with it.
Yeah. How long you been a paramedic now?
I've been a paramedic now for about 3 years. I've been in EMS about 4 years in total.
What got you into EMS?
Well, a little bit like Tyler, it wasn't my intentions initially to go into it. I was working straight out of high school, went into a blue-collar job. I was going door to door, replacing people's electric meters and water meters. That brought me out to a miserable town that's in the middle of the state, farm town. There's nothing for miles around, and they set me up in a trailer park. It's the middle of winter. It's freezing cold. Wind comes right off the ocean and just plows over the state because there's not a single tree. First week I was there, the pipes froze. The heat stopped working, and then it rained really bad, and my trailer got infested with ants, and that's when I decided I needed a change. I was just looking around at guys that were 30, 40 years old doing the same thing I was, making the same money I was.
It was going anywhere.
I got to go to school. I come from a family of healthcare providers. My father was a firefighter for 27 years. My brother was a firefighter straight out of high school. So I started in the EMT program at Gwinnett Tech. I originally was going to stop at EMT and go into the fire route. But then I realized that, okay, I want to expand my scope a little more. Went into A school. That's where I met some good friends who motivated me to go straight through to paramedic. And I've been here ever since, so a little over 3 years being a medic now.
So any of you guys have some stories or calls that stand out in your career?
One call that hits close to home, a heavy-hitting story that felt really real and viscerally emotional for me, was a scene that Andrea was on. We got called out to a cardiac arrest. The notes were not great on this going to the call, so we kind of didn't know what we were going into. We just heard there's CPR in progress on scene. We arrive on the scene. We're the first ones to get there, and we walk into the front door, and I just hear screaming. And she's like, I'm upstairs. So I go upstairs, and the first sight that I see is a mother doing CPR on her daughter, who's roughly 16, 17 years old. At this point, I'm like 22, 23, and I have a little sister who's also around that age. So we get up to her. I pick her up, put her on the ground. Mom leaves the room. She's hysterical. We start the process. We start CPR. I put the pads on. Rhythm was asystole. We get the drill in. I'm trying to get an airway in, but I realized that the jaw was rigored at this point. I just couldn't stop care. Just the scene itself and the emotions attached to it. I had to do everything I could to try, even though in hindsight, there's not much chance of that working out. But we worked the call. Fire arrived. Then Andrea came. She was supervising that day. And she was a huge help on this scene because my mind's kind of all over the place. It's one of those moments where it's a little hard to verbalize and instruct people to do things because you're in your head so much about what's going on.
How long were you a medic when this call happened?
A little over a year. I never worked an EMS job before being a paramedic, so this was all very fresh to me, very new experiences. Every call I was going to was, a bit of a adrenaline dump, regardless of what it was, fall, granny fall, or a chest pain call. I was just expected everyone was going to die in the beginning. But this one was really hard, and Andrea was amazing. She came in and offered to call the hospital for me for doctor's orders. She got the field term authorization, and then we ended care and had the very, very hard task of talking to the mother about the death of her daughter. It turns out that it was an overdose. A friend gave her some pills or something along those lines, opioid, narcotic pills. Yeah. And she was gone before we got there, but that was a really hard one for me.
Yeah, that's awful.
Yeah, Andrea. I remember that call. That was actually a really emotional call for everybody on that scene. We all go to cardiac arrests all the time, but some of them just hit you differently, especially when it's someone who's young and then you see a family member on scene who they see what we're doing, but they know that there's nothing more that we're going to be able to do. They haven't accepted it yet, but you just know, they know that things aren't going to end well. And so for me, it was upsetting too, because when I came in, Bella and Mitchell are doing everything they can and doing everything right. And sometimes just things don't go as planned. Seeing her lifeless body it shook me, because my daughter is almost the same age, same body type, same frame. You think about the family and everything that's going on. But I remember talking to the mom, and the mom was like hysterical, and she said, I just knew when I was at work and she never left to go to work, I knew something was wrong. And Bella and Mitchell, they're so young. I mean, they're only like a few years older than this patient. So that's an emotional thing for them as well. But they handled it very well. I ended up taking them out of service that day so they could just kind of process what happened, because sometimes you need that to just kind of decompress. So, yeah.
When you were responding to the call, what was going through your head? You knew they were on scene and what they were working.
For me, it was a little bit of a distance to go to that call. But the fact that it was Mitchell and Bella, they're young, Mitchell, newer medic, I just wanted to go to the call so I could be a support system for them, not to be there to call the shots or do anything, but just be there for supportive care, And I'm glad I did, because maybe I won't make it in time before they start transporting. But I was like, no, something told me you need to keep going. And I'm glad I did, because it took me no time to get there.
Rolling up on a call, and the patient's got rigor, you said, right?
Yeah, well, rigor in the jaw, that was the only place I couldn't open the mouth to get an airway. We ended up having to NPA and bag. It was the best we could do. But thank God for Andrea being there, because I was not in the headspace to be able to call this into the hospital.
Yeah. And to be quite honest, it was kind of a questionable call to walk in to look at her and be like, oh, she's gone. I would have probably done the same. And also
the experience, I think, right, of knowing where this is going.
Yeah, I would have probably done the same thing that Mitchell did. There's a lot of emotions going on, and I know we're taught to control our emotions and to maintain the chaos on scenes, but sometimes the human inside you, the compassion that you have, you're sitting here watching this mother crying hysterical.
Agonizing.
Yeah, exactly.
It's a very different experience working a young person who has years of life ahead of them versus working a 90-year-old that's in a retirement community, maybe bedbound. The quality of life is degraded over the years. It's a very different emotional response to those two situations.
Because you're not, you're going to see someone who's elderly. You're going to come across people like that passing away. It happens every day, right?
Extensive medical history, right?
Right, exactly. Like that's just life. But when a 17-year-old, they're not supposed to die that early. So it's tragic. And then it affects everybody on the scene. You can go your whole life preparing for moments like this, but until you're faced with them and you're in the middle of it, you can't. You don't know how you're going to react.
Wow, right?
Yeah,
that's a powerful story. Thank you for sharing that.
Yeah, of course.
Thank you, man.
Yeah. Any calls stick out in your career?
Yes.
Wait a minute. That's my job.
Somebody's got to keep this thing rolling.
So, Tyler, any calls stand out in your career?
Yes. Very early on in my career, I was probably a medic for 8 months when this one came out. I was with my very first partner. He was a brand new advanced when I was a brand new medic. Both of us had never worked 911, and both of us had the same amount of EMS experience in general.
And he went on to become a physician.
He's currently in med school right now. He's working real hard.
Yeah.
But yeah, very early on, we got dispatched to what I heard as a 70-year-old male having difficulty breathing. We were about 3 minutes from the call, and we started pulling up. I remember him saying, "Tyler, I think it's a 7-year-old." I checked the call notes, and it turned out it was a 7-day-old infant with difficulty breathing, and it was at an apartment complex on the 3rd floor because they're always on the 3rd floor. We got the stretcher over there, and I was getting ready to grab the monitor. I had this gut feeling that something was wrong. I told my partner, "Okay, grab the monitor. I'm going to grab the jump bag and just go run up and see what's going on." And I get up there, and I'm out of breath because I'm out of shape. And I remember the mom opening the door, and Dad is standing inside, and I see a limp baby, and he just looks at me and in the most monotone, almost shell-shocked expression says, "I don't think he's breathing." And I've never had time slow so fast in my life where it was as if I was just moving in fluid motion. I ran up, I grabbed the child from the parents' arms, and sure enough, he wasn't breathing. He didn't react to me. He didn't cry. He didn't move. And I had that brief moment of, am I going to really work this pediatric arrest, which it would have been my first, here in the parents' apartment.
You're responding to this call thinking it's a 70-year-old, right?
Yeah. And it was not even seconds before I get there. I'm like, oh, it's a 7-day-old.
And they're in cardiac arrest.
Yeah.
God almighty.
And I ended up having that moment of, do I work this child here? Do I bring him down to the stretcher? And looked at the parents. I said, we're going to CHOA. Grab what you need and meet me in the ambulance. I come barreling down the stairs, and I yell at my partner as I'm going towards the ambulance, "Hey, he's not breathing. Let's go." We get him into the ambulance. About that time, fire's rolling up on scene, and I yell to the fire captain, "Hey, he's not breathing. I'm going to need a rider." Right as I laid the child down on the bench seat, he let out the loudest cry I've ever heard in my life. And ended up having return of spontaneous respirations. His color improved dramatically. Ended up not being as serious of a call as it could have been. What I later found out was the child had thrown up after a feeding, stimulated his vagus nerve, passed out, and forgot how to breathe. The act of forcefully putting him down on the bench seat stimulated him enough to breathe again. And I found that out because literally the very next day, when I went up to the hospital, I saw the parents with the child in one of the trauma rooms. I remember going to the charge nurse, and I was like, "What happened to this child? I literally just had him last night." She ran through what had happened, and it turns out it happened to him again after we left.
Wow.
I bet that cry was just echoing in your ears. Relief.
Yeah, like, thank God.
Yeah. And what's scarily funny about that is, since that incident, I've had that almost exact same call 3 more times. And every time it just gets more and more terrifying because I'm like, it's going to happen. I know it's going to happen. One of these times, this kid's not going to wake up and I'm going to be scarred emotionally for life.
That's an understatement.
Andrea, do you have any calls that stand out?
Yeah, actually, I do. Well, I have so many that stand out, but this one in particular stands out. And I remember it so well because it went on to affect me throughout my life. It has affected me. And so I went to a call for, the notes were kind of all over the place, so it was unclear what I was going to. I get on scene, and I think someone's injured, and I'm so new, I really don't have an idea what's going on. We were walking up to someone, and the person's on their knees, elbows are extended out and hunched over. And so I'm like, oh, this guy doesn't feel good. And as we get closer, I'm like, what are these pieces on the ground? Like, oh, it's just his brain. I'm like, this is insane. I was just in utter shock. But what happened was he fell from a parking garage, but no one witnessed it. And the area he was in was kind of an area you kind of had to do a little digging to figure out that he fell from a parking garage. He was deceased, and that was my first call where the person had died on the scene due to trauma. So that was a big deal for me. But how it affected me, and the reason why it stands out the most, is it was during spring break, and he was really young. I believe he was a nursing student. So, he had a life ahead of him and he just came down to have fun and, he doesn't get to return back. That was kind of upsetting. I ended up having to go to some more calls at some hotels that night. One of the hotels I went to, we were on the 24th floor and the wind was whipping and it was night. After seeing that call and going to this next hotel, I was absolutely terrified being that high. And I remember we were pulling the stretcher to the room and I had my back up to the hotel walls and I'm just scaling along the walls because I'm absolutely terrified. And so after we cleared that call, we got back to our station and I just lay there wide awake, just thinking of everything that just happened. Honestly, since that day, moving forward, I haven't been the same when it comes to heights. I have this terrifying fear of heights, and it didn't used to exist to that capacity before. If I'm in a hotel and I'm in an elevator and it's got the glass windows, around it, I have to look at the dial because I can't look out because my palms start, they're sweaty, my heart's racing. It never really clicked to me till later on throughout my career. I'm like, well, I guess that's considered a moment of PTSD where a call affected me to the point where now I've just have this insane fear of heights. That is one of the calls that echoes in my head today.
Wow.
Yeah.
Most of the hotels I stay in are ground level.
Yeah.
There are no glass elevators.
I don't like balconies. If I stay in a hotel balcony, it can't be over the fourth floor. Or if it is a hotel that's pretty high, no balconies. I don't mind the windows and I'll look at them, but even still at a distance, and they'll just peek out. But yeah, my daughter's always made fun of me about it, but it's an absolute fear for me. And that's probably one of the big reasons why I never went on to pursue a career in fire, because I'm like, I gotta climb a ladder. Once I get over a couple feet, I'm like, oh, this is it. I'm starting to panic. My palms are sweaty and I'm always like, what can I do to change this? I hate it because it's kind of crippling.
Hey, it's Jason Falvey. Thank you for spending part of your day with me here on In Service. If something from this episode hit home, maybe it reminded you of a call, a shift, or a hard lesson learned, follow the show and please send it to just one person and ask them to follow. Now let's get in service. Did you consciously choose a program that would accelerate you to paramedic as quickly as it did, or were you kind of caught up in the momentum of going through EMT school?
Yeah, for me, it started out going through EMT school and realizing that the scope wasn't all that I thought it would be. I wanted to do more and have more of an effect. So then went to A school, and during this time I'd never worked in the field aside from clinicals, and then I realized, hey, I'm already most of the way here, and I don't want to go back through school later, so I'll just do it now. So, yeah, for me, I guess it was a mix of progression. The more you get into it, the more you want to be able to do more and have more of an impact. And I had a couple professors tell me, I was like, maybe I'll stop as an A, work for a little while, get my feet wet. One of the instructors said, what kind of experience are you truly going to get if you're just driving the ambulance? And I was like, right.
Yeah, but you get comfortable using all the other type of equipment, just moving patients.
Yeah. No doubt. It would definitely make a difference, but I wanted to be able to administer a certain level of care, and that just led me right into paramedic.
Yeah.
I went to the same school as Mitchell. I did Gwinnett Tech's program. Coming from Arizona to here, I was already looking at schools in Arizona, so I kind of had an idea of what the curriculum was going to look like. Coming here and finding out that instead of just EMT and paramedics, here in Georgia you guys have EMTs, advanced EMTs and paramedics, was kind of like, oh, I'm going to have to spend more money. Great. I had no real ambition to go to paramedic school. I was just going to go to EMT school and kind of get my feet wet, see what EMS was like. But while inside EMT school, I also felt very frustrated like Mitchell. We're being taught how to solve certain problems, but then our hands get tied behind our backs with our scope of practice. I was like, this is not the level of provider I want to be. I want to be able to show up on scene and feel like I'm able to administer a certain level of care to what the general public would expect. Or to what I guess I should say what I would expect if I called 911. And as an EMT, I couldn't see myself doing that. So then I went to advanced, And once I finished the advanced program, same thing like Mitchell, the group that I had gone through EMT and advanced EMT with, there was a good portion of us, I believe it was 6 of us at the time, that were all like, we're going to paramedic school. And it starts in a week. And I was like, oh.
Hop on the bandwagon.
Yeah, I'll try out this paramedic thing and see how it goes. And I've really enjoyed it, in all honesty. I had some great instructors. I had some great classmates. And I've had
It's
some
like
great
hard.
girls.
You don't make it, whatever.
We're in it together. Yeah.
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 Yeah, because my experience wasn't the same as Mitchell's and Tyler's. I actually worked actively as an EMT while I was going through school, and the opportunity came up for me when I completed EMT school to jump into medic school.
I don't think it's that unusual for somebody to complete EMT or advanced EMT training and enroll in medic school.
Yeah.
And then work in the field. I
Yeah.
think that's pretty common now. What I think is uncommon and more in line with Zero to Hero is Mitchell's approach, right? Mm-hmm. I think that's more, but limited field experience, I think fits right into this category of Zero to Hero.
Yeah.
Right? That compressed time format. That's really what we're talking about.
I was
Yeah.
just thinking about Zero to Hero. I was thinking about the saying. I just never heard that till I moved up here to Georgia.
Zero to Hero?
Yeah. Never
I-
heard that till I moved up here.
I was still so new into it. I hadn't heard it in Arizona. So maybe that's just a Georgian thing.
Oh, no.
All y'all are
No, it's
Zero
up
to
north.
Heroes.
They use term up north too.
Oh.
Yeah. What do you think? Have you heard it before?
Yeah, I mean,
Well, I mean, yeah,
Yeah.
it's a Georgia thing.
Well, do you have anybody that in the
that's what
family
everyone
that's
says.
EMS?
They're like,
Huh?
oh,
Do you have
how
anybody
long
in
you
your
been
family that was
a paramedic? I'm like, oh, like 6
could be
months.
why,
They're
too.
like, oh, how long were you an EMT before that? I was like, I wasn't. They're like, oh, Zero to Hero.
I mean, that could be why, too, is the fact that me and Andrea didn't have family that were in EMS. So I'd never heard that term. But, Mitchell, your dad and brother have been in EMS for a while.
I probably heard it from my brother first.
Yeah.
When I was 18 and I wanted to be a paramedic, you had to have an associate degree and you had to have like A&P 1.
Was there a moment where you felt like when you got in the field that it's nothing like school?
One of the things that really stands out to me, just right off the bat, like, you know, you have your dealing with family members and managing scenes and all of the small social interactions that are outside of just do this, this, and this to help the patient. One funny story that comes to mind is I showed up on scene to a psych call. It was a woman in her 30s. She was naked on the side of the road. We show up.
You get a lot of naked calls.
I get a lot. This is just the first naked story.
We're going to
First
get
of
into
many.
the guy with the coveted butter
yeah.
later on.
We're going to get into that. But
You got to
this
tell the
one,
better story.
so this lady was laying on this hill on the side of the road, and PD's, you know, approaching her and trying to calm her down and de-escalate. She's just butterflying her legs and shouting at them. And one of the officers go, you know, I come up. She's just completely irate. It's one of those situations where no amount of de-escalation is going to solve this. You can be as compassionate and understanding as you want to be, but at the end of the day, sometimes people just are not in the mental state to be able to receive that. Like, you know, later found out that she was bipolar, having a manic episode, been off her meds for a couple weeks, kind of thing. And so an officer goes up to her to try and get her onto the stretcher, and she reaches to her left, grabs a stick, and starts whipping the officer. So they jump on her, and all the fire guys run over. I'm like, okay, now I got to sedate her. This is my first time ever having to sedate a patient. I'm looking at the protocols, like, okay, this weight for this dose, and I'm trying to like do the mental math, going pretty slow. You know, the officers
They're like,
are on
"Hurry
top.
up!"
I know, the officers are on top of her. She's biting and spitting and fighting, and the fire guys are over there cursing me. Eventually, I get the meds drawn up.
Hold on. Hold on.
And I'm like, hold her. Finally sedated her. But it was definitely, you can't really teach the sense of urgency that you need. And also just my first time sedating somebody, I didn't want to give her a heroic dose of ketamine that would completely cut her respiratory
Yeah.
drive or
They're in the
whatever.
K-hole.
So, exactly. Well,
End you up in court.
It is what we did. But,
Nobody wants to end up in court.
I've figured out how to do that in a much faster way now, but it was really funny.
What about the first time, you show up in scene and then everybody kind of turns and looks at you for what to do? Did you have one of those moments?
Yeah, I spent a year and a half in school working as an EMT, doing a lot of clinicals, going through paramedic school, continuing to do clinicals. So I'm riding the coattails of my preceptors. So I don't really have to do a whole lot of, I got to think, but it's not on me ultimately. So I was able to use those preceptors as a crutch. So, once I got out of school, it's just me. And everybody else is looking at you like you know what's going on. And you don't. But they're looking at you for the answers, and you're just like, I'm winging it here at this point, I think that was the moment where I was like, wow, this is certainly a lot different than school.
Yeah, you get all the education and training you need, but you get out into the field, suddenly you got to make decisions, and nobody else is making them for you.
Right, yeah.
Yeah.
You're the one that's supposed to be able to read that 12 lead. You're supposed to know the drugs you're supposed to give, you know what I mean?
You can't always turn to somebody and say, what do you think? What do you think about this one?
Right, yeah, for sure.
That can be a really shocking moment to find yourself in.
Andrew, didn't you have to work a respiratory arrest early on when you first became an independent medic?
Oh, yeah, it was my lieutenant's mom, so
Wow.
yeah, it was absolutely terrifying. It was like a first day being released as a medic. I remember going to her house. I had no idea at the time that it was his mom. He talked to his dad, and his dad thought she had passed. My lieutenant called dispatch and was like, hey, don't send the fire department. He just assumed she had passed and just wanted someone to go over there to
Was she a
pronounce
hospice
her.
patient?
No, she had liver problems, and the Xanax she was taking wasn't metabolizing properly in the liver, and she had the toxicity to the Xanax. So she was not breathing. That was what was going on with her. So, which is insane, because in a call like that, didn't have anybody to help us. It was just my partner and I. He come with a ton of experience. The guy could run circles around me. So it was great having him. That was a late call for him. He was waiting on someone to come from another station. So I'm glad it worked out where he was with me. But yeah, I ended up intubating my lieutenant's mom, and I felt like everything around me was moving in slow motion. But it was probably the most perfect airway I've ever seen in my life. Sunk that tube and stood up.
He's there to support you.
No, he was an EMT. He was my partner. I didn't have anybody on the scene with me other than my partner and I, and he's an EMT. So, he knows his skills as an EMT, but as far as anyone else, it was just, him and I, and eventually the police department showed up, and that's it. We didn't have anybody, but we also didn't have our radios on us, so we weren't able to call for backup to get someone to come help us. So we just kind of had to wing it.
That's why you always carry your radio.
Yeah.
That's why you always have it on you.
Live and learn. Actually,
Not just for help, but for help.
For situations like that.
Yeah. I think one of the things you gain from working in the field before becoming a paramedic is just seeing patients. You get to see multiple respiratory patients. And so it kind of gives you an index to work off of, right? This is mild, this is moderate, this is severe, and you've seen it. So give us a moment where maybe your lack of field experience forced a hesitation or a second guessing.
I have one for that.
Go ahead.
For sure.
Yeah,
Go ahead, Tyler.
Sorry.
Thank you, Mitchell.
You're welcome, Jay.
I'm very hesitant, Mitchell. All right. Sorry. A story that comes up very early on for me would be that. Oh, it's for the hesitation. Ben.
That's Ben.
Gotcha.
What do you say to you? Good morning? Was that?
No, he said,
I felt it.
It was the Scandinavian. Good morning.
It's not.
we're good friends.
Did you beat him in ping pong last night?
No, he didn't play last night.
That's why he's a little agitated this morning. Go ahead. I'm sorry.
So what was the question?
Did you find a situation where your limited field experience might have caused a situation or forced a situation where you second-guessed yourself on a call?
Yeah, I would say for me that would be very early on in my career. I was probably a medic for around a year and a half max. It was my very first STEMI call that I ever had. And it was a pretty clear-cut call. It came out as a 45-year-old male, chest pain, recent onset of AFib, was placed on blood thinners. We got on scene and it given me the 12 lead and looked at it, and very quickly I identified it was a inferior STEMI with elevation in 2-3 and AVF. Unknown if there was any right-sided involvement. I don't think they did a reverse 12 lead on, or reverse 12 lead.
Reverse
Right-sided.
V4.
Yeah, right V4. Thank you, Mitchell. I don't think they did a right V4 on him. It was more just I saw it. I was like, oh, I know what this is. I've seen this 1,000 times in the classroom. I actually never had a STEMI in the field, even during my clinical experience, but saw it in the classroom, identified it right
And
away.
that particular STEMI is triggering a red flag, right?
Yeah, right off the bat. I'm already going through how we treat it, what our protocols are, and I hear out the corner of my ear another paramedic on scene say, all right, sir, what I just gave you is called nitroglycerin. And my heart sank on that call because it was this entire plan that I had set up just went right out the window. Now I've moved from trying to manage and maintain the STEMI to making sure my patient doesn't decompensate. And I remember walking up to the patient and the other paramedic is sitting there and he's trying to give me a report, and I hear like the Charlie Brown parent talking as I'm looking at the monitor and I see a systolic pressure of 94. And it's like, this is just getting worse and worse. This is not what the classroom is like.
Did they have a line on them already?
No line, nothing was in place.
Yeah, especially with inferior STEMI. If there is right side involvement, which was not ruled out, and you give
Right.
nitro, you can tank that person really quick.
Exactly. And that's kind of what was going through my head. We have our protocols. We've already called the hospital. They know we're coming in. And I'm like, okay, great. I'll have another paramedic with me. That's great. Even though this paramedic just gave nitro, I'll have somebody to bounce ideas off of. We get him into the ambulance, and he's in the captain's chair.
What does the patient look like at this time?
He's still talking. He's saying that he's got 8 out of 10 chest pain, but he's answering questions appropriately. He's still alert and still, fairly stable, unstable patient.
Yeah.
And other medics calling up his med control, trying to get orders and figure out dosages. Meanwhile, I'm getting a line, getting fluids hung, trying to maintain his pressure. And then I hear the medic say, sir, what's your pain at? And the guy mutters, it's like an 8 out of 10. And he hands me the nitro, and he's like, go ahead and give him another nitro. And I'd asked, what's his pressure at? The medic gave me no response. And I had that moment of, I know I'm a brand new medic, and I know this other medic seems to be more seasoned, but I don't trust what he's saying.
Yeah, you know that this is not
Right.
the pathway for you.
Exactly. I remember pocketing the nitro, and we get a little bit further down the road to the hospital, and he hands me a syringe. And I'm like, go ahead and push this. I was like, okay, what's in the syringe? He gave me no response. I was like, if you're not going to tell me what it is, I'm not going to push it. So I put that in my pocket. I later found out that it was a medication that was not within our protocols, but is within this other medic's protocols. And so I didn't push that. And then he asked him again. And by this point, the patient's starting to further decompensate. He's becoming a lot more pale. He's not as talkative. He's only really responsive to verbal stimuli. And I had asked him, what's the patient's pressure at? Still no response from him. He asked the patient, well, what's your pain level at? And he barely is able to mutter a 6. And he says, give him another nitro. I just remember sitting there on the bench seat, looking at this patient and going like, is there something else that I don't know? Hold on, let me rephrase that.
What are you missing a piece here?
Yeah, I remember.
Like, what am I not understanding
Yeah.
about this?
Exactly. Like I remember sitting there on the bench and just wondering, is there something I'm missing? Is like I know I'm a brand new medic, and I know that he's a more experienced or more seasoned medic, but I know our protocols. I know these drugs. I know how these things interact. I remember thinking this isn't right, and I had that little gut interaction of, is there something I'm missing? And I started second guessing like everything I was doing on that call on whether or not I was being a bad provider. And all of that went right out the window the moment we got to the hospital. I finally like demanded a blood pressure from this other medic. And he tells me it's 86 systolic. That's when all those second guessing just went right out the window. And I'm like,
if you had given him those other nitros, he wouldn't be at like 40 systolic.
You would have been working.
Yeah.
You'd be doing compressions, probably.
Yeah.
would have been
PR
talking to
working.
Jesus by that point. I just remember hearing that pressure and all of that second guessing went right out of my head. And I was like, no, I made the right choice. I acted as a competent provider. I knew what I was talking about. I remember when we got to the hospital and we were giving a report and the other medic was detailing everything that we were doing. The doctor was looking at me like I was the crazy one for going through with this. And I had to chime in saying, well, actually, no, I didn't give the nitro. No, I didn't give this other medication. And yes, the patient is on blood thinners. The other medic got very frustrated with me and told the doctor, seems like he knows more about this patient than I do. You can get the rest of your report from him, and just walked out the room.
That's got to be an incredibly challenging situation to be in, especially as a fairly new medic at that point. But honestly, you're coming out of school, your knowledge level is pretty much at its height at that point. You tested out on all this stuff. You know it inside and out. And you have to sit with our medical director to get authorization to practice. So he's testing you on this as well. And now you're in the back of a truck, real world, with a patient, a very critical patient, potentially critical. And somebody wants to take a course of action. It may, well, honestly, I couldn't imagine that would all fall within his treatment protocol as well for being a right-sided STEMI, right? Inferior
Yeah.
right-sided.
That's the thing is they didn't know if it was in right side.
Right.
That
So, I mean, even if it was right-sided involvement, again, I didn't see any indication.
if you have a systolic pressure of 90,
Yeah,
you
you're
don't
not
give
getting-
more nitro.
I mean, that was the other thing. I feel like even if
that's the
there
other
is
thing.
right-sided
That's
involvement,
ridiculous.
Yeah, there's so many things here, right?
especially with no line.
But let's focus more on the challenge of you have a seasoned medic. It could just be an incredible challenge. What do you do? Are you going to engage this person in a debate over what the cost of treatment is going to be? Or do you just stop it?
And I feel like this is where I had a mentor very early on. He was a very seasoned paramedic. He taught paramedic school at a fire academy, was head of a trauma department at the hospital for a little bit. He was very knowledgeable. When he found out I was in paramedic school, he gave me a piece of advice saying, be aware that no matter how much experience you have, no matter how many years you're in the field, never be afraid to say something if you see something's going wrong, because these are people's lives you're dealing with. And if you're not going to advocate for them, who is? And that's a piece of advice that always stuck with me.
Yeah, and imagine if you had just gone along with everything that other medic was saying, and then all of a sudden your patient's in arrest, and I guess you can justify it, be like, oh, well, I wasn't the one who made these decisions, but you also weren't the one who stopped it.
And it's also on my ambulance.
Yeah,
And it's my name
exactly.
on the report, so it's really hard for me to justify, hey, if you're a competent paramedic and you knew this was wrong, why'd you do it?
Challenging situation.
Yeah, absolutely. Terrifying.
Andrea, how do you handle that? You have another provider on scene that wants to engage a course of treatment that you know is not correct.
I guess, honestly, that's where you take what you know and everything you've learned. If you know that that's not right for the patient, you have to speak up. You have to say something. It's an uncomfortable conversation because, you take someone who has experience and you think they know what's going on, but experience doesn't necessarily mean knowledgeable.
You have to be able to have a discussion over the best course of action. You don't want it to become a hostile situation with the other provider. So there's a balance there. But ultimately, if there's something occurring that's dangerous to the patient, you really have to stop it. As Mitchell was saying, yeah, I agree with that. Do you guys recall an exact shift, moment, or call where you felt like you were actually functioning as a paramedic? I got this. I'm in the zone?
I think for me, it was more of a just time in the field kind of thing. It probably took me a year and a half before I didn't have a huge adrenaline response every time I got a call, because I was just expecting everything to go terribly wrong. And it's easy to get in your head about that sort of thing, especially when this being my first time in the field and having all this responsibility. But you go through and work some critical calls, you get some saves, you learn how to manage scenes and family members and all the stuff that goes along with just keeping a call moving in the right direction. And eventually you just get your groove. And I think that's the best way to explain it. And it took me like a year and a half to really feel like, okay, I'm not terrified.
Yeah, and you're a really good provider, Mitchell. You've done incredibly well. There's no doubt about that.
Yeah, one of the things that was really scary is that going through all of my clinicals in medic school, I never really worked an arrest in the field. All my arrests were in the ICU, where all I am is hands. No doctors looking at me like, all right, what do you do, paramedic student? So
What drug do you push?
and then, I was double medicked starting out, and we didn't get a single critical call. Everything was BLS. It was like a curse. Like, it's the one time I really wish that,
Yeah.
Dookie would hit the fan, and it just never happened. And it wasn't until I got with a EMT that was, she was not great and not very helpful. There was no sort of unspoken interactions going on. It was a bit of a mess. And that's when I got all my horrible calls. It's like, okay, now we're
It
working.
kind of forces you, right? Really step
I
in.
remember
her.
My first cardiac arrest was a absolute shit show. Like we came to a alpha level abdominal pain call, and we get there, lady's upright talking, it's a colostomy bag. I'm like, okay, she's in a lot of pain. So I get her on the stretcher, and we're moving her out into the ambulance, and she just is like, don't let me die. We put her in the ambulance, and as soon as we get in the ambulance, I'm getting up next to her, and she goes unresponsive. I feel for a pulse. There's no pulse. So immediately I'm on compressions because I'm right there on the chest. So I go, hey, partner, give me the pads. She throws me the pads, doesn't plug them into the monitor. Then I'm like, okay, get the BVM. Grabs the BVM, fumbles with the BVM. This was not a quick grabbing of the BVM. Didn't hook it up to oxygen. Everything's going wrong. No OPA, no MPA. Just starts bagging at like 60 times a minute. I'm like, what are you doing? And so I'm like, I'm also trying to communicate with fire, trying to get them out there. They show up on scene to the front of the building. We're around the back of the building, and they go, EMS left, show us back in service. I'm like, we're here, we're in the back. So then fire comes into the back, and I think after like 2 or 3 epi, we got ROSC, which, it was
Awesome.
honestly my first like 4 arrests I worked, I got ROSC, which is like an insane hit rate.
You're going to be prepared for like major letdown.
Yeah. Oh, no,
Just kidding.
exactly. Like 3% of cardiac
Those are high
arrests.
numbers.
Or so. Like, it
You're
was-
the 3%, by the way.
It was, it was ridiculous. But so I had good luck, but like, dealing with situation like that where it's basically all on me. And that was really brutal awakening into becoming a competent medic. It made me very self-sufficient and empowered me to become the provider I am today. I feel like I can do a lot of things by myself, and let alone with a competent partner. There's basically nothing we can't handle.
Yeah, so you work in a cardiac arrest. You ask for an ambu bag, and they don't. They don't hook it up to oxygen for you.
Don't hook it up with oxygen. Just mask to face, squeezing it like 2 times a second. I'm like, what? There's no advanced airway, and it was a mess. We don't have enough hands, so I'm like, okay, well, you get on chest compressions. Gets on chest compressions. I drop the eye-gel, do all the things, and then fire finally gets there. And by the time they get there, I was trying to get an airway, so I still don't have a IO in. So then we get the IO, start pushing the epi, and she came back pretty quickly after that. But it was just a mess. That was definitely the worst cardiac arrest I've ever executed as far as flow goes.
That's the worst.
It was my
That's rough.
first one ever, too. And it's having a person arrest right in front of you gives them the absolute best chance of survival from CPR.
Coming out of that, man, you must have felt like, yeah, I can do that. I got this.
Yeah.
Yeah.
Yeah, absolutely. Especially as, I got a new partner and she was a brand new EMT, and I basically got to mold her into the perfect partner for me. And so there was a lot of unspoken communication and just a lot of flow, and she knew what I needed and how I functioned, and it really started to be really easy after that.
Yeah.
Inquiring minds want to know what happened. Do you know what the outcome was?
Of the cardiac arrest?
Yeah.
We got Rosk, and Rosk was maintained in the hospital, and she went to the ICU. I don't know further.
Oh, okay.
I'm sorry, but I think that's a real shame. I wish there was a way we could communicate with the hospital staff to find out what happens to some of our more critical patients, because I would love to know.
I'm like, is it a massive GI?
Honestly, I don't know the reason why she arrested. I would assume it was something along the lines of sepsis, like maybe some issue with the colostomy where she had some perforation and was getting fecal matter in her abdominal cavity causing sepsis. I mean, that's my best guess because we weren't talking for very long before she just arrested.
I think part of the problem with the follow-up, you go back in service, you move on to the next call. You can send an email to our clinical manager and he can request that information. You're already 10 calls into this before you'd think to do that.
The department I work at, we transport patients to a hospital in our area. And if you transport that patient there, once you're completed, we report. I get a notification in EHR, and it tells you the outcome of the patient, which is great. That's never been a tool I've ever used in my career.
Yeah, I'm
And
familiar
this is
with that
something
system.
really new. And so
That's awesome.
It's really, I'll go back and I'm like, I never saw that coming.
Yeah, I feel like
Yeah,
it's
like-
great just from an educational standpoint, too, is a lot of times we are just giving our best guess and being able to know, like, oh, was I on the right track? Was I way off? And be able to
Yeah.
apply that into future calls that you go
Absolutely.
into.
I had an in-STEMI recently. I would have never known that. I mean, aside from him having chest pain, but treated him the appropriate chest pain protocol. But being able to go back and get a notification, seeing that he actually did have an in-STEMI, I was like, oh, wow, this is awesome to have.
It's
this.
reaffirming, right?
Yeah.
To know that you were on the right course of treatment. But I was reading an article now that there are departments in software that is tying into the hospital so you can access certain information within the patient's health record, like medications, history. Yeah.
Which is
from the field.
Yeah, and that's so useful when it comes to patient care. You come across patients, they're like, oh, so-and-so has my information. And it's like, okay, we don't, but it would be such a convenience for us to have that information, especially if a patient's really sick or critical and you're trying to scramble to get all that information and then you get everybody stabilized and you're like, oh, I don't know what medication they take. They have allergies and all that stuff.
The staff at the nursing home, they're
No
like,
idea.
oh, we don't have the paperwork.
This is my first day here. I don't know this guy.
You take a handful of pills every morning. You don't know why you're
Right,
taking
yeah, exactly. A lot of people do not know their medical history, actually.
And even going with the medication, that's one of the harder parts about the nursing homes. So many of these nursing homes have med techs that just hand the medications out to the patient, so they don't know what they're taking. And a lot of times, even the med techs don't know what they're giving them.
Yeah.
They're not trained to the level of knowledge to like, hey, these are what these medications are. These are what they do. It's just like, oh, you get 2 blue pills in the morning, 2 red pills
It's a
at night.
mechanical action.
Yeah.
Yeah.
Yeah, it's like they're taking care of 50, 60 people in one nursing facility. It's crazy for them to know exactly what medication each patient takes. That's just not something the average person's going to be able to recall and recollect. Yeah.
You're coming out of paramedic school, or in paramedic school, you do clinical rides to get certain skills to complete your certification. And then when you come out and you're certified, you're going to do upgrade rides. Did your ride times, did that time in the field fill in all the gaps for you, or did it barely scratch the surface?
Yeah, for me, it absolutely did not. I was a white cloud all the way through medic school, I swear. Like, I was just BLS stuff and maybe some asthma. Did hundreds of hours of clinical rides at ED or emergency department, ICU. I did all the things, but one of the things that I was just unlucky with is that generally when I was out on the truck, it wasn't real. We didn't really run into anything crazy. Like, had some broken legs and whatnot, but I didn't have any cardiac arrests or big calls where you need to use meds like active seizures and all sorts of things that I had to learn for the first time or see for the first time when I was on the truck in charge.
Yeah.
And I was the exact opposite. I was about as black of a cloud as a black cloud could get. I had cardiac arrest after cardiac arrest. I knew our ACLS protocols before we ever went through them in paramedic school, just because I had so many by that point, and I had so many medics that were like, hey, this is what drugs you push. This is at the rate you push them. You know, this is what this rhythm is. This is what that rhythm is. I had gunshots. I had stabbings. I had suicides. I was a black cloud throughout my paramedic journey and
Lucky
even
dog.
EMT.
That can be good and bad too, right?
The good part about it is that the responsibility isn't on your shoulders. You're a student. If something goes terribly wrong, it's not on you. So then going from that to being in the field, especially in my case where I didn't get any super critical stuff, and all the critical stuff I had was in the ED or in the hospital setting where we're basically just seen as extra hands.
Go draw that
Can
blood.
you draw this blood?
Yeah, exactly.
Can you take this patient to X-ray? That's preparing me for the asthma patient, right?
To be fair, though, Mitchell, we also had the opportunity to do catheters in the ER, and I don't think anybody ever did that in our
Put
class.
it in NG tube.
That's
Nice.
better than a catheter.
Were you allowed to put that NG tube in?
Our instructor said, if somebody tells you to put a tube in a hole, do it.
When you got out on the road, what skill, when you performed it live on your own, really felt like it exposed your experience?
I think we all talked about this collectively. It was CPAP for sure.
Yeah.
Is it
Like,
the mechanics of putting it all together and getting it on the patient, or what element of CPAP?
One part of it is that, no two CPAPs are the same.
Yeah,
So
there's so many manufacturers.
you open it up, and especially if it's your first time using that particular brand of CPAP, it's a bit of a puzzle to put together. And when you're using CPAP, it's because you need CPAP like now.
right now. Yeah.
So it can be a little bit of like a panic moment where you're like, crap, how do I do it?
On top of that panic, your patient's panicking because
Yeah.
you're trying to put a mask on their face when they can't breathe. So there's that whole psychological aspect of it where you're trying to coax them into letting you put this mask on their face and trying to explain to them how it's going to benefit them. But they're like, I see something covering my face. This doesn't make sense.
Yeah, and figuring
It's
out the
lies.
PEEP settings too. You're like, which way is blowing harder? Like, ask the patient, can you breathe? Can you breathe? Can you breathe?
like
You're
the
just
outro,
twisting the
just-
knob.
Can you breathe better with this or like this? 1, 2, 1, 2.
If you talk to older paramedics that were in the field before CPAP, CPAP was a game changer. Mm-hmm. Yeah, it really was. It's funny to hear that, opening that thing.
Yeah.
It's different going from the classroom environment where it's like, oh, yeah, this is the CPAP you're trained on. This is how it works. This is how you set it up to you get in the field and you're like, I don't know what this is. This isn't the one I was trained on. What is this monstrosity?
There's so many of them out there. Yeah.
It gets even crazier when they're like, oh, hey, let's add a nebulizer into that. You're like, what? What?
Where does it plug in?
What does this mean?
Do you remember this one? It's funny you brought up nebulizer. So when I was in paramedic school, I had the bright idea of, can I attach a nebulizer to a BVM and do a nebulized treatment with the BVM? And do you remember what our program director told me to do? Were you in here during that moment?
I don't know. I don't remember.
I told my program director this because I had this brilliant idea. He was like, you know what, George? Assemble it for me. I want you to build it for me and show me how this works. So I took this little nebulizer, I took a BVM, I cannibalized the living heck out of everything, and I did it. I successfully made it, and I think I surprised him until he said, go down the hall to the respiratory department and show their program director this and see what they say. And I did. I walked out there all happy, showed it to them, and their program director was like, but why? if you're having to bag the patient, you have much bigger problems on hand than a nebulized treatment. And I was like, oh, you got me there.
As you're
set you
bagging
up
them,
for
you're like, I'm
failure.
hearing
Yeah.
some wheezing.
Was that the moment you said, you could have just said that to me?
Yeah, and I came back and he was like, what they say? And I'm
What
like,
they say?
I was like, well, they said if I'm having to bag the patient, I have bigger issues at hand. I was like, you could have told me that before I walked down there. He's like, no, I wanted to see how long it would take you to figure that out.
In your defense, I had a really bad respiratory call. The guy was just like coughing up large amounts of clots, and he was struggling. He was a patient that we were going to do RSI on, and he would not tolerate a CPAP machine. And so in between, during that time he was going in and out, I would bag him because he was combative. You know, he's hypoxic. That was a chaotic call. So in a situation like that, I don't know that the albuterol would have helped the clotting, but at least I can get, I have, basically, I guess my point was I have bagged someone who was awake and that would not tolerate any kind of CPAP.
Was that a TB call or?
No, he had like
Well, also you get into
lung
situations.
cancer. He coughed up a large clot when we got on scene. He didn't continue to keep coughing up clots throughout the transport, but he was in severe respiratory distress. He wasn't moving any air. And again, it was so chaotic because he couldn't breathe. And he wouldn't sit still on the stretcher. So I had to call my lieutenant to intercept so he could jump on the truck with me and we get RSI because he was in really bad shape. And it turned out he had metastatic lung cancer. He was just home vacationing at the beach and everything at dinner. And yeah, anyway, didn't mean to steal that moment. But yeah, have definitely bagged somebody who was awake and semi-alert.
No.
Yeah. So you tell them.
But
You've got good
could he
ideas.
follow commands? Because that's one of the necessities to be able to use CPAP.
So where do fast-track medics struggle the most?
I think the biggest thing is all of the auxiliary things that you have to deal with as a medic. You go into these situations and you have knowledge about certain treatment pathways, but there's so many variables that you can't account for in a classroom, like what sort of mental state people are in, people around the scene, how their interactions with you will change, how quickly you can move through the treatment pathway, and you have
Do you think it's
cultural differences.
scene size up?
I think it's more of a management of the auxiliary variables, like the things around the call, getting good information from people, de-escalating stressful situations where people are panicking and yelling.
Kind of finding your voice as a paramedic in a sense. Because I feel like when you're in class, all of your classmates and all of your instructors, you're all kind of on the same page and you know what's expected and are willing to listen to each other. But when you get out into the field, you have so many unknown variables with fire, PD, and civilians, and like finding that voice as a paramedic and saying, hey, you go do this, you go do that. Dealing with the civilian side of it, even with, like you said, oh gosh, help me out here, Andrea.
Yeah, I know. Like, scenes can get really unpredictable. I got
Yeah.
a great story for this. This is my first day working with my new EMT partner. First day in any EMS job for her. We're still on the first date basis, like small talk, getting to know one another. And it's like 5:30 in the morning, and we get dispatched to that's a good start right there.
So that's like the first call.
This is the very first call we've ever ran together. Don't even know each other's last names at this point. We were going to this call, and the notes were a little all over the place. It turns out this guy was schizophrenic, bipolar, had been off of his meds for a unknown amount of time, and he decided that morning to go into the. He made his way into the bathroom, and he got completely undressed, at which point he walked back out, went behind the counter where they're cooking, and everyone's freaking out. They're like, there's a naked man coming over here. So everyone's scattering.
It's not unusual for the...
He reaches both hands into like the vats of like cooking butter. He grabs 2 big handfuls of butter and starts rubbing it all over his naked body. And then he stands up on the counter and starts aggressively pleasuring himself while yelling at the the staff members. And I want you to picture now PD's showing up, and they have to now wrestle this naked butter man with a hard on. And so he's like slipping out of their grasp, and like, eventually they get him in handcuffs, and they're like, okay, time to make this EMS's problem.
Right.
So we get there, and they put him on our stretcher. It was funny. He was pretty calm. We're trying to talk to him and like figure out what's going on, and he's like, yeah, the voices told me to do it. I had to do it. I'm like, okay. One of the cops comes over. He's like, hey, man, like, how did you get over here this morning? He goes, I levitated.
As you do.
And me and my partner are looking at each other like, what is going on?
First thing in the morning.
We don't have this guy's name. We don't have his date of birth. I'm just calling the hospital, and I'm like, hey, we're coming with the naked butterman. We'll see you in 10.
I mean, can you even restrain a guy like that? He's gonna slip right
Yeah,
out.
It's a very slippery
Yeah.
situation.
That's a really great story.
That is.
And that's that whole you just can't make up situation that you've been in. They're just insane.
I always say that I feel like my life is a movie, but I'm never the main character.
Yeah, right. Yeah, never main character.
Wow. That's a powerful story.
Not the right response.
That's a real tearjerker.
It's a real jerker or something.
Yeah, somebody's jerking.
That's a
the
deeply
tears.
emotional story.
Not the tears. I would stand back and be like, "This is fucking real." I'm like, "This is real." So I would just go grab my narcs and be like, "Hey, my God."
That's
those
realistic.
But
moments.
you know what? It's calls like that, though, that just make this so interesting. You're not entering numbers into a spreadsheet all day. How often do you see a naked man with butter on him?
Right.
Right? So do you guys feel the fast track paramedic pipeline produces competent paramedics, or do you think it creates avoidable risk?
I remember one time I was working with an EMT eye. She'd been an eye for over 20-something years. I mean, this person can run circles around me. I mean, she knows her stuff. But she told me one time when we were working together, in conversation, it got brought up that I went straight from EMT school to medic. And she's like, I can't believe that you went from EMT to medic. She's like, I never would have guessed that. And she's like, there's a deficiency that you see in people like that. And I'm like, well, what is it? Can you explain what kind of deficiencies she sees? And she said one of the biggest things that she sees among EMTs that go straight into paramedic is their ability to talk to people. She said they tend to be a little bit more demanding to their partners because they were never put in that role as an EMT where the demands were made to them. They went from just getting into EMS and calling the shots from day one. They were never in a role where they worked under a medic and the medic called the shots.
Maybe the learning curve is steeper, but I'm not seeing that.
That's her experience and that's
Yeah.
her opinion in that role. And so she was like, that's not something I've ever seen out of you. And there's that perspective of things. You just don't know what you're doing coming into it from any aspect because you're just brand new to EMS as a whole.
A big part of it is that there's a certain type of person that is able to do it. You've got to be very confident in yourself. You can't really second guess when you're in high stress situations.
You got to be mentally resilient.
Yeah.
You have to be very mentally resilient. The stuff that you have to see and just objectively look at and put your subjective brain aside. So there's a certain level of thick skin you got to have to thrive, but you also have to have a good amount of empathy because situations can be resolved by that empathy that you have.
Communication skills.
A
soft
big
skills.
part is just being there's a certain type of person that's able to thrive in a leadership position and be able to keep a cool head and just be able to keep things rolling smoothly.
I do. I definitely, throughout my career, and I mean, I've been doing this for 10 years, I definitely find that people that did spend time as an EMT and spent time in the EMT role tend to come out stronger in their role as a paramedic than the average person who went straight from EMT to medic. Because you can be 19 years old, go straight into EMT and become a medic, but in my opinion, you haven't lived life at all. So not only are you, that's a learning curve, but now you're taking on that role as a EMT paramedic, delegating, doing all that stuff, being assertive. And so, it, again, takes a special person that can handle situations like that. And not everybody can do it. I'm sorry.
Go ahead.
I recommend it. From my personal experience, I would not change anything about what I did. I recommend it to anybody who is considering that, like, hey, this is what you're going to be exposed to. Are you ready for those things?
I agree with that. I wouldn't let the lack of field experience be a barrier to you pursuing a career as a paramedic.
Right.
In speaking to Mitchell, no amount of training is going to prepare you for butter man.
Right, yeah.
You
absolutely.
have to be able to adjust and shift to chaotic environments, and that's pretty chaotic. Maybe not an MVC on the highway, but that's a very chaotic environment.
That's EMS as a whole. You're not prepared for 90% of the stuff that you come across. You can talk about all the different things in school. They burn certain things in your brain that that you're going to deal with these situations. And, we were talking about it earlier before this podcast, like some of that stuff you don't even come across years and years into your career. You cannot prepare for those things. There's so many things that they just cannot mentally prepare you for. And so you will learn that really quickly in this field, whether you're in an EMT role or you're in a paramedic role, whether this is something that you're going to be able to manage and be able to get through without issues later on.
I feel like a really big part of becoming a competent medic is just experience. You got to do the thing. You got to be in those shoes, and you get a certain exposure to things as a lower level of care provider. But truly and honestly, I think that it's the experience of being that lead man, making those hard decisions. That's what makes a good medic. I tell people all the time, my patients are like, "Oh, you're so young." And I'm like, "Oh, it's about the mileage, not the years." It all comes down to experience and exposure to these situations and managing them. If you are going 0 to hero and you're just starting out, it's going to be a learning curve. You're not going to be a top-notch medic as soon as you start. It takes time to cultivate that and to find your groove.
But I would say at the same time, though, if you are thinking about going from 0 to hero, you have to be somebody that is very confident in your skills, very confident in your abilities, but also have the ability, like we've said numerous times, to adapt to a very chaotic situation and realize that no matter what you learn in school, you're going to see these situations one way and then very quickly find out when you get into the field that it's almost always going to be the complete opposite.
You're never going to be prepared for every situation that you come across.
I do have a little disagreement with that. I think that's the idea of going to school, is that you're able to build on that confidence.
Yeah, you need a foundation.
Yeah, I've always struggled with confidence myself. And I remember being in EMT school and panicking about putting someone on a backboard. When I look back in hindsight and I'm like, oh my God, like, that's insane. That's what I was worried about. I think like where I'm at now, and I'm like, that's the least of my worries. But at the time, because I wanted it so bad, those were the things that bothered me. So my confidence was pretty low going into EMT school. And then learning the skills, getting the experience, that's where you build all that confidence. So, yeah.
What piece of advice would you give somebody that's thinking about doing the fast track program, 0 to hero?
Do it. Go for it.
Get in there.
Try your hand, I mean, the best way to learn is to do, and the best way to do is to be a medic. I mean, you're going to be able to have the full scope of abilities to help a person out. I do think it's a wise thing to work during your school. It's just something I didn't do. They're dealing with equipment. I remember the first time I had to put a PD mate on a stretcher, or managing a stair chair, all the little things that you don't super think about while you're going through school, but are just really practical applications of this job.
Yeah.
I would definitely say go through with it.
I would say, given beginning of when I started this and to where I'm at now, I've been able to precept a lot of students throughout my career. And the one thing that I see a lot of students, and that especially like, people who didn't have experience prior to going into this, they compare themselves to me. Like I've had this in so many situations where my medic students in particular compared themselves to me. And I'm like, listen, I've spent the last 10 years of my life perfecting this role. You just come into it and you've not even been in that position. You're not even working in the position. Don't compare yourself to where someone else is, because everybody learns at a different pace and adapts at their own level. Even if you may not know a lot of things, over time, you're going to pick up on those things. So my biggest thing is don't be hard on yourself. Don't beat yourself up because you're not there yet. It's something over time that you're going to get better at. Just make sure you're always doing the right thing. Make sure you don't lose that compassion and empathy, because that's when You have to take a step back and be like, maybe this isn't the right role for me. I think that's one of the biggest things in EMS, having that empathy and compassion.
I also think that a big advantage to have as a brand new paramedic is more experienced paramedics around you that you can talk about certain calls and how you ran it, what things they might have done differently, and just being able to constantly grow and improve yourself by transparency.
I have an interesting story, really quick. I had a EMT, super smart guy. He'd been an EMT maybe 6 months. He was my partner, and we had a really bad hypotensive patient, and he was going in and out of consciousness. And there was no fire response, and so it's just myself, a student, and him. And I just wanted to get him out there because he was, really going downhill, and I wanted to prevent him from going into cardiac arrest. We were doing everything in our capacity to improve his blood pressure, meds, fluids, all the things. And so I was like, we got to get him downstairs. I called for fire. I'm like, let's go ahead and get on the backboard. Let's get him downstairs. I took him downstairs, feet first. He's just kind of like, ooh, I threw the bag on him. We threw the fluid bag on him, and we're trying to get him downstairs. And he's got blood backing up into the bag because it's just chaotic.
You said feet first or head first?
We're going feet first. But he's sliding off the backboard. It was a struggle getting him down there. It was 2 grown guys helping and myself. We finally get him down to the stairs, and then fire's rolling up about that time. And we get him in the ambulance, whatever, move on. He doesn't code. The meds are working. We got, everything's going on. But my partner's like, why did we just wait for fire? Because they were like pulling up, and you were like, let's go. This guy has been in this job for like 3 months, and I'm 10 years in this role, and I'm like, I don't really know, because it was a pretty slippery situation. Like, we were just a movement away from dropping this guy on a backboard down the stairs.
Right.
Yeah, it's just like a few extra seconds we could have waited. I've done all the things I need to do as far as treatment. He's good at this point. I mean, his blood pressure was like 50 systolic, so it was really low, but we could have waited a few seconds for fire. And I still think about that sometimes. I'm like, I was just acting in the moment instead of like, hey, we see them pulling up and we're coming down the stairs.
Isn't there a natural tendency to want to evolve the call, right? You've done all the care, and now it's time to move them to the truck.
So
yeah,
That's fair.
I know it was more like, all right, we got to just get out of here, because what's the likelihood they're going to show up in a timely manner? So
Right.
I was already committed, and then we see them in the window driving up, and they're like, what? We're doing it. But it was kind of funny because the way he was angled, his blood was backing up into the back. And so no one had hands to flush that line because we're kind of stuck on the stairs.
right.
And so I made a joke, and I was like, well, his blood pressure was fine, and now we just pulled all the rest of it out of him.
God. Well, I just got infused.
No, but we did get him to the hospital in better shape than he was.
That's
So
good.
yeah, it was,
So problem solved.
yeah. But I guess that's the point. It's like, we got a new person here. He's just because he's not, experienced doesn't mean he doesn't bring something to the table.
And I was going to bring that up too, which is being a brand new medic, or really even just brand new in any aspect of EMS. Don't be afraid to ask questions. That was something I did all the time as a brand new medic with every critical call I had.
I'm very well aware. I was a supervisor on that
Yeah.
shift when he was like new to.
Yeah, so like I was always coming to you like,
got
hey.
calls from them every
Yeah.
Oh yeah. No, like just about every other
I
shift.
felt
would
useful
call you.
actually at that.
Yeah, just because I was always genuinely curious. Like, is there something different I could have done on this call? Is there something more I could have done on this call? I'll never forget my very first pediatric seizure, and I handled it the way I thought was appropriate, giving Versed and making sure the patient wasn't choking on their own sputum. And we get to the hospital, and the pediatric nurse was like, "Oh, you could have just let him seize. It's okay. You didn't have to give Versed." I'm like, "Oh, that's not what I was thinking."
For a reason.
She didn't give me a reason. She might have been a new nurse. But I mean, it was
Yeah,
just,
that doesn't
yeah,
sound right.
this little
I'm
12-year-old.
still going to do what my protocols tell
Yeah.
me to do. My
But I mean-
common sense tells me to do.
It was just always like little moments like that, though, where it's like any call that I always thought was critical, I would always like ask the nurse or ask the doctor, like, "Hey, I'm brand new here. Is there anything?"
Well,
you
somebody
think I could
says
have done
something like
different?"
that to you, it really, you start to question your foundation of information you're working off
Yeah.
of. Like, am I missing something huge here? Let the patient seize? That doesn't fall in line. Yeah.
Yeah. Sometimes I feel like we just kind of get put on the back burner. I think it's extremely important for us as providers to have a meeting with our medical director before anything else. It's important that the transporting agency is aware of these new studies, these new changes, because we're the ones a lot of times go to calls just on our own, just EMS response only. We come across that pretty regularly. Yeah.
Hey, thank you guys for coming in this morning, giving up your time to do this podcast. You're all excellent paramedics. You do a fantastic job out there every day. I'm certainly very fortunate to have you guys working with me. I appreciate each and every one of you and your contributions every shift. And my life right now is much more fulfilled knowing about the Butterman.
I know, right?
Oh, the Butterman.
Thanks for having us, Jay.
You can go your whole life preparing for moments like this, but until you're faced with them and you're in the middle of it, you can't. You don't know how you're going to react.
Wow, right?
Yeah.
That's a powerful story. Thank you for sharing that.
Yeah, of course.
Tyler, you have a story that stands out in your career?
Lighten it up.
Wow. Yeah, I once had a naked
Follow
guy
that.
covered in
I was going to
butter.
say that's a really that was an unfair follow. I'm sure Tyler's already
Follow that
Yeah.
story.
crying in the corner.
You know what? You want? I had a.
Oh,
No, I'm joking. So I did. In all
You
seriousness,
shouldn't joke about
sicko.
Oh, that's not this kind of channel.
What did you?
I'm going to struggle with cutting it out. So don't
No,
torture me.
Tyler.
Yeah.
Any calls stick out in your career?
Yes.
Hey,
There
wait
was
a minute. That's my job.
Thank you for listening to In Service, the EMS podcast, where frontline experience meets leadership insight. If you have found value in this conversation, please like, subscribe, share, and leave a comment. You will find links in the episode notes.